to try and show you how you can use the network submissions review coach to help create the pitch slide decks plus a script. So within the screen we've got two things. One is an example OKRS with program and projects. On the right of the screen we've got the AI coach. So the first thing we just need to do is the prompt, which is attached in the email, we include in there. Yep. And then all we want to do is the two attached examples. We will then include those, so it knows what to compare to, so you can just scroll those across. So those are those two files. Then all we need to do is to copy the program description. So that's selecting those squares, copy. Make sure, so when you're doing an enter using it, you have to do the shift and enter. Otherwise it will start the prompt. So we're literally doing that, and you're just copying all the text. Then what we want is to do the same for each of the projects. Doesn't matter too much, I've just copied and pasted that project one. Second project one, I'm just literally copying and paste. Again, make sure you're down the bottom. Shift, enter. And it does go, so you can see it, and then paste that next one. And again, once again, all the way down to the bottom. Shift and enter and paste. So that's now got the outcomes text and the three, for this case, project text. Okay, 1, 2, and 3. So you've asked it to use these as an example. You've given it a prompt and copied those in. You then click on it, go. And then if I expand that, it will take a little while to read everything and think that through. And then it should produce the text for a more detailed, in terms of words, slide deck, a simplified, more bullet point slide deck, which is better for presenting, and then the script, which you can then use for each of those slides. And again, you need to adapt it and make sure it's authentic, but hopefully what this does is gives you 80% of the work done. And what we're aiming to do is to show you how you can use the work you've already done with the outcomes at project and program level. Gives you a very powerful way of giving that message across to people who want to know more about what it is you're trying to do, the difference you're going to make, and the beginnings of that credibility. So that's still thinking it through. It's now, as you can see, reading it and thinking about it, and it then starts to produce that script. So again, it's trying to reinforce that hopefully the work you're doing with these OKRSs is not just a submission template piece of work, but actually helps clarify the purpose of what you're doing, because engagement will not be this one-off event for these pitches. We need to work continually across the year at engagement, but having a clear elevator pitch as they can be called, knowing when somebody asks what very clearly it is you're trying to achieve, what difference you're trying to make, why is that important, will help that engagement, both providers, because through your operational manager links, but also as ICBs change and evolve and the new structures, we'll need to re-engage with those. So as you can see, it's fairly near the end. So first of all, you can see there's a long form. So with each slide, there's quite a detailed description. The first one is your introductory slides. Obviously, that's not going to be there. Again, these words you'll need to adapt. So here we have the slide 3, using the guide. What we said was about people, so the clinicians, families, patients, provider, how is it helping them, and sort of the NHS priority. So these 3 pillars of what we're trying to do. So that's therefore producing those slides. So that's how you can produce your own. So I'll leave that now. As you can see, it's working its way through it. The final slide that we've added as a recommendation is that works best. That's the ask, if you like, of what you're going to need from providers, and that as a way of engagement. So here's then the short form. So it's the same information, but in more simple bullet pointed elements. So you can just copy and paste these bullet points. Obviously, you've got your own individual formats working through it. Brief descriptions of each of the projects. That network role, again, just in bullet point forms, because bullet points work very well, obviously, as a visual hook that people can read those. And at the same time, you're using the same messaging, but a different set of words to talk through it, which gives you the audio hook. So people can cognitively manage both those elements, particularly when they're around the same thing. And then what it will produce is the actual dialogue script for each of those slides. So that's how you can use it. The link is in them there. It's a fairly simple, easy way that hopefully helps you if you're stuck to produce a very good pitch presentation with a long form set of slides that we can add as a PDF. So people want to take that away, download it, a short form, which is your presentation, and your script, which you can then use to put in the notes for yourself and your clinical lead. So just a quick demonstration there of how you can use it.